Alright, here we go. My name is Nathan Vasquez and I am going to show you how to do a Dmek. So, let me put my gloves on really quick. This is a 75-year-old patient. The older the donor, the easier it is to do the peel, and the easier it is for the surgeon to do the Dmek surgery. So, a Dmek involves, we're going to use a 9.5 millimeter tree fine to cut a circle around the edge of the cornea. We are going to separate it from that edge, and then we're going to peel. We're going to place an orientation mark. In this case, it will be an S mark. And we sometimes use an F mark depending on the surgeon's preference. We're going to dry it, and we're going to lay it back in the viewing chamber, then we're going to be good to go. So, to start off, here's the cornea. I'm going to put it inside a small bath of BSS for about a minute. This just makes the cornea easier to peel. There's my little BSS bath. Okay. So here we got a Troutman forceps. We got our S mark. We have a microfinger to help the initial separation around the border. Or we have a reverse Sinski. And this does the same thing as the microfinger. So I'll show you both ways. We have our dye right here, Vision Blue. Oh, we also have our peeling forceps. You could use any type of forceps. You could also use the Troutmans, but I like these. Some different ones you'll have to grab this way and peel. But these particular Guels, we peel this way. Okay, we have our Optisol inside our 2 millimeter syringe. And we have our skin marker for the S mark. So, let's grab our cornea. It's been about a minute give or take. I'm going to dry some of the excess BSS because too much BSS will make the cornea swell up, which will make a cell count a bit difficult to do. So I'm also going to rinse off that excess BSS. Okay. I'm going to dry the epi a little bit. And I'm going to place it on our stage. So this stage is from Moria. It comes with our 9.5 millimeter punch. Oh, also very critical to note that this cornea is pseudophakic, so there are 2 scars with not much clear zone, about maybe 8.5. So I actually looked at the scars prior to kind of gauge where exactly they're at. I even drew a little picture, so I know that based off of these landmarks, the scars are going to be about here and here. I think you could actually see that one already. So I'm going to, we normally don't use the dye yet, but because of the scars, we are going to do a couple drops just so they'll show up, because I want to try to avoid them as best as I can. So they should be around this about 6 o'clock and 9 o'clock in this orientation. So the dye should be up to a minute, because I'm really I just want to see these 2 little scars. I want those to show up. Okay, that's probably good. I'm going to draw up this dye. Okay, just like that. You can see they did kind of show up. You see right here, the large one, about 2.7 millimeters, and this one, about 1.3, I think the evaluation said. So I'm going to get rid of the excess dye here. Quick rinse in the BSS bath. And then, so I want to try to punch away from these scars. I want to avoid them as much as possible. So how do I do that? Well, glad you asked. Let's try that puppy up. So I'm going to mark up my 9.5 millimeter punch here, and I'm going to mark it here so that I can see where exactly this 9.5 is going to cut. So I will center the cornea based off of this circle so that I could avoid the scars. Okay. Boom. Do a little wiggle. Kind of see it showing up there. So you didn't really mark well, but it did leave the cut. Left a little indentation, so you can kind of see the indentation. I will situate it on this side because that's where the ink is showing best. Okay. Getting the cornea right now. I'm drying that epi side because I don't really want a wet stage because it will get into these little suction holes. Okay. You see the scars are showing nicely. I'm going to try to put the scars on the outside as much as possible, but at the same time I don't want the 9.5 punch to go outside the actual cornea. So it'd be much easier if the ink did fully show. Okay. Let's see. I'm looking at that. Okay, the cornea might be a little bit too small to fully have the 9.5 punch. Okay. Let me try to mark up the punch one more time because you can't really get second chances here with the Dmek. You want to minimize as many problems as you can. So in this case, instead of having the wild card of not knowing where exactly we're punching, we're just going to ink it up again. Okay. Try this up. Let's see if this shows better. There we go. Much better. That's probably good enough. Marker. Alright, let's try this again. Driving the cornea. Drying up the epi once more. So, it's very important with Dmek and with any cornea procedure, you don't want to touch that endothelium. So, you'll see me avoiding it at all costs. Always. So now you could see where that 9.5 punch is going to go. So I might be able to avoid it altogether. It's going to be tight. This might be sufficient. Okay, so we see the border, it's still within the cornea. I think that's the best we got. I'm going to, but at the same time, it's really in a bad place because this rim is so darn high. So I'm not sure if it's, oh, I think it should be good. Okay. Boom. Just put some pressure like across. North, south, west, and east. Putting my thumb, some good pressure all the way around. Okay, I'm going to grab the rim. Actually, got the rim here. Kind of coming with the punch, and we're good. So I forgot to show you on camera, I put a little suction so that the cornea will stay in place. So I remove the suction now. Okay, so we have it drastically off center, but that was necessary if we wanted to avoid the scars. So we're going to dye it once more. Just a few drops. This is not a preload, so I don't have to worry about saving some of that dye. Okie dokie. So while it's dyeing, so the edges are going to dye blue much more than the center. You're going to see cell dropout dyed blue because this dye will dye the Descemet's membrane. So if there's endothelial cells, it will not dye or stain. But if there's cell dropout, there's an area where Descemet's membrane is exposed, so it will dye blue. And then you will see the edge dyed blue. I'm going to tear the edge. It's known as tearing the skirt or removing the skirt because it's on the edge. I did not come up with that name. We are going to, it's been about a minute, so I'll draw up some of that dye. Let the gauze do its job. Okie dokie. Going to do another rinse in the BSS, quick rinse. Then another quick rinse in the Optisol. Like I said before, too much BSS will induce edema, and doing the specular cell count afterwards will be much harder. So I'm rinsing the BSS off of the cornea. Okie dokie. So let's try to center this guy a little bit. Okay, so the scars are on this. There's a scar here. It looks like I was able to avoid it. And a scar down here. It might still be poking its head over there. But for the most part, we have a clean 9.5 diameter cornea to play with. So we always want to keep the cornea submerged in Optisol, or at least the endothelium. So we're gonna throw some drops in here. You don't want it to overflow. Okay. I'm gonna give it some light suction. So I'm just going to give it about maybe 0.75 milliliters of volume. So I'm going to twist it as I'm releasing. So now we got some suction. I'm gonna use my Troutman again. And we're gonna just tug at the edge just to make sure that the punch did its job and cut all the way through. It's a guarded punch, so it's not supposed to cut all the way through full depth. So you see it's already coming off here. I'm just gonna peel away, and I'm putting these tears onto the gauze. So removing this just gives you a clean working surface on the edge. Okay. So this is Dmek's membrane that I'm peeling off with endothelium. So we got stroma here, and then we got the full thickness cornea here with Dmek's and endothelium. We got a lot of cell dropout on the edge. A little bit of cell dropout there where the scars are. We're going to dive right in, Ant-Man style. Boom. How does that look? Okay. I'm going to take my micro finger. Here she is. A little bit sharp, but also bulbous. So I'm holding it. I guess I'll show you how I like to hold it. So you want to be really in control of your instruments. So I got my index, my middle finger, my thumb on top, and it's a really strong hold. You don't want to squeeze it tight, but you want to be in full control. Oh, and also to stabilize, since we're dealing with microns here, I'm putting my ring finger on the edge just so I'm not all wobbly. So this will stabilize right here on the edge. Okay. So I'm just going to put this little sharp end just on the edge. And then we're going to split this puppy like a hot knife through butter. So we got some tears here because we got a lot of cell dropout. So the Dmek's is really weak. I'm going to try to remove that. Okay. Nice and slow. So you see on this edge, it's pretty weak. So I'm kind of just removing away. So tears are not your friend. You want to minimize them as much as possible. Especially the single line tears, which we might see a little bit later. Okay, so right now you see how the tears they're curvy, which is nice. If they were in a straight line, peeling could induce a full-on tear all the way central. So we're gonna keep these wavy tears. Okay. So most of the time you will not have tears like this, but because I had to make the punch really off center, we're playing in this trabecular meshwork on the edge. Okay, so we went through the storm and now slicing like normal again. I don't know if you could see it. Checking the camera here. Okay, can you see that? Yes, you can. Slice right through. Oh, I'll show you the micro finger. I mean, not the micro finger. That was just the micro finger. This is the reverse Sinski. Same idea. So it's kind of awkward because it's such a long tool, but I'm holding it the same way as I was the micro finger. So this Sinski, it's much cheaper. It's like 35 bucks versus a few hundred for the micro finger. The micro finger is prone to breaking off the tip, whereas a Sinski is pretty strong. We haven't had one break yet. It's not as clean. I don't like it as much. I don't know if this is just a bad spot or bad luck with the Sinski. Okay, let's try to clean up this tear, make sure everything's good. Okay, it was just the edge. So also if you have little tears like that, it's good to get rid of them, just so they don't become larger. Always minimize tears. So I switch back to my weapon of choice, the micro finger. Okay, here's a scar. So we might, I'm gonna try to go central to this scar. It's kind of hard because I don't have it dyed. Sometimes you might just want to make the scar your hinge. Hinge being where you're going to peel towards. So if I wanted to make this my hinge, I would peel this way and stop around here. That way it doesn't even matter that you have a scar there because you're not even peeling from that edge. Okay, so we got a line tear there, so I might just make that my hinge. So let's skip that. Okay. So sometimes it's hard to crack open here. So this cornea, because the donor is 75 years old, it's pretty easy. But sometimes after the 9.5 punch, this decimate is sealed pretty well to the stroma. So it might take some time to like crack this open. Another way to crack it open would be to grab forceps and kind of induce peeling as if you were already starting to peel, and a lot of times it'll crack it open in a small little spot or create a tear. Then you could enter in through that tear. So here we go, back to start. So it's a bit messy on this side where there's a lot of slow dropout, but there's no big line tears, and we minimize the tears in general. So we got a scar here, the big scar here, and then the one on this side that we were able to avoid. I think it was where we had that little hiccup on that side. So I'm going to peel 12 o'clock to 6 o'clock, north to south. Taking my peeling tool, the Guels. You can just as easily peel with the Troutman. So the idea with the peel is you're going to try to grab the edge of the decimase. Try to have your tool as perpendicular as possible, because it's kind of hard to grab like this and rotate your wrist.
How much longer are you going to take?
20 minutes?
20 minutes. Okay. Sorry.
Okay, sorry about that. So it's kind of hard to rotate your wrist as you're peeling. So apparently I have to hurry up. So I'm just going to grab this side. Again, this is where the cornea is pretty weak, so it might tear. And then sorry, when people walk by, we're on the second floor, so the floor likes to jump around a bit. Let's clean up these tears. Don't need you. Okay. Okay, let's try over here. Nice and slow. Very, very slow. This decimase membrane is about 10 microns. Compare that to the cornea, which is, one would think the cornea is thin, it's about 600 microns. So 10 versus 600, that'll let you know how thin this puppy is. So what I also do is, instead of really peeling down, a lot of it is me with my thumb moving up, because this is more of a steady movement compared to that. So I'm doing a little bit of both. So I kind of started over there. Again, your hinge in this case will be your scar. So I'm turning it to 3 o'clock. So my peeling style is start with 12, wherever that might be, and then gradually peel the edges so that where it's adhered is just going to be kind of like a small rectangle, so with less chance of tearing. So I started at 12, I'm rotating to the 3. So because of the age being 75, it's not adhered as tightly, which makes it easier for me. Let's change this focus up a little bit. Okay, again, my hinge is right there. So you don't want to peel at your hinge, because the hinge is where the decimase will still be attached. Okay. Again, hinge, 12 o'clock, scooting over to about 10. So this is where the other scar was, but I was able to avoid it with the 9-5 punch being off center. Nice and slow. So you see that straight horizontal line, that's good. That means that the decimase is not adhered tightly. If it was a smile, then that'll tell you that it is tightly. So then you would want to really do these edges just like I'm doing still. So I'll make it a habit, even though this decimase is not adhered tightly. So here we have a little tight spot on this side. So if you have a lot of glare there, so I'm just going to tilt the cornea a bit to avoid that glare. A little bit tight. That's okay. That just means you have to baby it a little bit. There's your hinge. That's the scar right there.
What's the drop diameter?
9.5.
For both of them?
Yeah.
OS.
Okay. So it's much easier on this side. So I might make the hinge kind of, I'll add this area since it's tight on this side. In this case, I could peel just up to the scar. Scar's right there, I see it. And we'll stop around there. Okay. Going back over here to 9 o'clock. So we had that little tight spot to the left. So I'm going real slow. Zoom in or change the focus a bit.
Do you remember what time you started?
Just estimate. That's Wilma. She likes to bug me when I'm performing delicate procedures. So another thing with Dmek, you're gonna come across problems with every single one, little problems. So you have to keep your cool. Listen to something nice. Maybe a little podcast. I'd like to get into podcasting myself. Nathan's Dmek podcast. Could whisper sweet nothings in your ear, just like this. Okay, so we're kind of tight here, back at 12 o'clock. So it was nice and loose here. So if there's no scars, I would have probably made my hinge somewhere on this side, because for some reason how it's adhered going from this way down is easier, but because of the scars, we don't have that variable to play with. We have to adhere by where the scars tell us to peel. Nice and slow, a little bit of smile, loosen up the edges again. Good. You see, you have to take your time with the peel. You try to rush, you get a tear, the whole cornea is done. The donor's wishes are not upheld, which is not a good thing. Okay, so here's your